The Ebola Epidemic. Ebola is a fatal virus because of its rapid spread and deadly nature. Its outbreak of 2014 to 2016 in West Africa was the dangerous one. It remained for decades, resulting worldwide anxiety, thousands of deaths and long-term regional devastation. In September 2022, Ebola killed 55 persons in Uganda. In January 2025, it has been reported again in Uganda. On January 29, 2025, a male nurse, employee of Malago Hospital, has died of it. Virus source, epidemic particulars, spreading of disease, treatment and post-discovery findings will be discussed in this video. Understanding the Ebola virus. What is Ebola virus? It is a member of the Filoviridae family. It causes a disease known as Ebola virus disease, EVD. For the most, it affects human and non-human primates including monkeys, apes and gorilla. Damages of the virus include organ failure, terrible bleeding, other symptoms and death. History and origin. Initially discovered at Ebola River in the Democratic Republic of the Congo in 1976, so named as Ebola. Several plagues have passed mainly through Central and West Africa. Different types of the Ebola virus. There are 5 known types of the Ebola virus. 1. Zaire Ebola virus, deadliest and responsible for West African outbreak. 2. Sudan Ebola virus. 3. Bundibugyo Ebola virus. 4. Reston Ebola virus, occurring in non-human primates. 5. Thai forest Ebola virus. The West African Ebola outbreak, 2014 to 2016. How the outbreak started. Initially it has erupted in December 2013, in a small Guinean community. People first took it as a little incident. The virus created a full-blown epidemic by spreading fast within the society and then across borders into Sierra Leone and Liberia. Countries affected. The primary countries affected by the outbreak were Guinea, Sierra Leone, Liberia. Virus was also reported in other countries like Nigeria, Senegal, Mali, the United States, the United Kingdom, Spain and Italy. Why this outbreak was the deadliest? Several factors contributed to the severity of this outbreak. Poor health system in countries under impact. High population mobility compounds containment issues. Delayed international response, allowed virus to spread unchecked. Cultural burial practices that involve direct contact with the dead. Transmission of the Ebola virus. How the virus spreads. Physical contact with body fluids, blood, saliva, vomit, urine, feces, sweat, semen, breast milk allows Ebola to be spread by infected individuals or dirty surfaces and items. Human-to-human transmission. Particularly among healthcare workers and caregivers, most cases arise from close contact with a contaminated individual. The virus remained in some body fluids, including semen, months after recovery, therefore it might still be transmitted even after symptoms have disappeared. Animal-to-human transmission. Through biting of animals, handling infected animals or eating bush meat, fruit bats, which can transmit the virus to primates or people are thought to be its source. Signs and diagnosis. Early stage signs. Ebola signs appear 2 to 21 days after exposure. Early signs resemble flu and include fever, fatigue, muscle pain, headache, sore throat. Advanced stage symptoms. As the disease progresses, it leads to vomiting and diarrhea, internal and external bleeding, organ failure, shock and death. How Ebola is diagnosed. Ebola is diagnosed through PCR, polymerase chain reaction, tests, antibody blood tests, virus isolation in laboratories, treatment and management, supportive care and hospital treatment. Since there is no particular treatment for Ebola, therapy emphasizes supportive care. Rehydration. Oxygen therapy. Managing blood pressure. Treating secondary infections. Experimental drugs and vaccines. SMAP, an experimental drug used during the outbreak. Remdesivir, a broad-spectrum antiviral. Inmazeb and Ibanga, approved Ebola treatments. Ervebo, initially approved vaccine for Ebola by FDA. Challenges in treating Ebola. Limited access to healthcare in affected regions. Difficulty in deploying experimental treatments. High fatality rates making research difficult. Controlling measures and prevention. Protection methods. Stopping Ebola requires meticulous cleanliness and staying away from those with symptoms. Among the most important steps are using alcoholic hand sanitizers or hand soap and water regularly. Stay away from bodily fluids of infected individuals. Not handling dead bodies of Ebola victims as they remain contagious. Avoiding bushmeat consumption and contact with wild animals, especially bats and primates. Timely reporting the symptoms to a hospital, if present. Role of healthcare workers. Healthcare workers are at high risk of infection. They have to follow strict safety measures, including usage of gloves, masks, gowns and goggles. Adhere to infection control policies, including correct medical waste management. Must quarantine infected people to prevent the virus from spreading. Using experimental treatments cautiously under medical supervision. Government and international response. By taking following steps, governments of the affected regions cooperated with World Health Organization, WHO, Centers for Disease Control and Prevention, CDC, and Médecins Sans Frontières, Doctors Without Borders. Creating quarantine zones in impacted regions. Deploying medical teams and resources to high-risk regions. Educating people about prevention and safe burial practices. Vaccinating at-risk people through innovative channels. Effect of the Ebola virus on West Africa. Human cost, deaths and survivors. The West African Ebola outbreak resulted in over 28,000 cases reported. More than 11,000 deaths, with the highest toll in Liberia, Sierra Leone and Wales. The recovered patients have long-term health problems like vision difficulties, mental problems and joint discomfort. Economic impact. The outbreak had devastating economic consequences, loss of workforce as people either died or were unable to work. Decline in foreign investments as businesses closed. Food deficiency caused by interruptions in trade and agriculture. Rising medical expenses straining already weak healthcare systems. Social and psychological effects. The outbreak led to significant social changes. Loss of trust in governments and medical institutions due to misinformation. Disruptions in education, with schools closing for months. Mental problems like post-traumatic stress disorder, PTSD, among those recovered and frontline workers. Lessons learned from the West African outbreak. Improvements in healthcare systems. The outbreak highlighted the need for stronger healthcare infrastructure, leading to better disease surveillance systems for early outbreak detection. Training of healthcare workers in infectious disease management. Improved emergency response strategies to prevent future outbreaks. Importance of global cooperation. The Ebola crisis demonstrated that international cooperation is essential in responding to global health emergencies. Outbreaks call for quick response teams already primed for deployment in different nations. Emerging infectious diseases should receive first attention from scientific research and financing. Development of vaccines. One main result of the epidemic was the fast development of the Ervebo shot, which has been since deployed in later Ebola outbreaks in the Democratic Republic of the Congo. The World Health Organization, WHO, and other agencies' role. WHO's response to the outbreak. WHO played a crucial role in declaration of Ebola virus a worldwide health emergency in 2014. Coordinating international aid efforts to affected regions. Developing guidelines for treating and preventing Ebola. Contributions from NGOs and international organizations. Médecins Sans Frontières, MSF, provided frontline healthcare services. CDC and European health agencies sent experts and resources to affected areas. UNICEF educated communities on hygiene and safe practices. Funding and aid efforts. Billions of dollars were allocated by World Bank, IMF and many donor countries. Funds were used for medical supplies, vaccine development, and restoration of healthcare systems. Ebola virus today, is the threat over? Current status of Ebola outbreaks. Even though the vaccine for Ebola epidemic was found in its previous outbreaks, but it was not totally vanished. Though countries nowadays have improved vaccines and preparedness response tools, but its discovery in January 2025 in Uganda is still an alarming situation. Risks of future outbreaks. Ebola remains a threat due to bats and primates still harbor the virus. Many African nations still have poor healthcare infrastructure. Potential mutations that might increase the spread of the virus. Conclusion. West Africa's 2014 to 2016 Ebola epidemic was a tragic event that took thousands of lives and left severe marks on impacted communities. Though the epidemic spurred notable advancements in vaccine creation and disease management, but still Ebola is a continuous worldwide threat to health. Preventing another terrible epidemic call for ongoing watchfulness, healthcare funding and global collaboration. History shows that pandemics respect no borders, so the world ought to be ready.